Well, hey everybody, good morning, good afternoon, and good evening, wherever you are in the world. I'm really happy to be joined by Dr. Sandy Leonard, and she goes by Doc Sandy Leonard. I love that. We'll just say let's start by saying hello, Dr. Leonard.
Howdy.
Howdy. So Dr. Leonard is a veterinarian, and she's got a very, very rich educational past and history. But she really loves chiropractic. So that makes her one of my favorite people in the world because I've seen chiropractic do miracles in my dogs. But first, let's take a longevity. Let's go right down the road of longevity. Your practice is working right now on a study. Can you tell us a little bit about that?
Yes, that's from the Loyal for Dogs. People may have seen it in social media or the newspaper. No, nobody reads the newspaper anymore. But Loyal for Dogs has begun a study in a drug that has been in use in dogs previously for other reasons. And their theory is that it can actually extend the lifespan, the healthy lifespan of older dogs. And we are one of only 2 clinics in the Kansas City area who are enrolling patients in that. There are certain qualifications. They have to be at least 10 years old, between 14 and 179 pounds. They have to be able to prove age. So they have to have some kind of document, either from a shelter, a veterinarian, registration papers, whatever, that either has a birth date or documents that a veterinarian saw that pet and recorded it as under 1 year old at some point, so that we can be pretty close on their age. And then there's certain drugs that they can't be taking, certain health problems that would disqualify them, but that's part of our screening process. But anybody that's interested, there are up to about a dozen visits within a 4-year period. They get the study drug for free. They get the examinations and required lab testing done for free. If the patient gets sick at any point and they think it could be potentially related to the drug, the study pays for that as well to check it out. And they get $100 credit each time they fill out a quality of life survey, which happens, I believe it's 9 times over the study. So that's potentially $900 that can be then credited to their account here for other purposes. So they do get some money back on that. Plus their pet's getting excellent care. They're getting regular physical exams, regular blood work, urinalysis, actually doing some DNA testing. So it's excellent care for these older pets and has the potential, if they're receiving the study drug and not the placebo, assuming it works the way they conjecture, may extend their lifespan in a healthy way. So it's kind of a win-win for everybody.
Interesting. Okay. And do we know what the drug is that they're giving dogs?
We do not. It's a double-blinded study, and that means that the veterinarians, the clients, and actually most of the study group don't know if that pet's receiving the drug or not. The people who package the drug to mail it to us know whether the pet is getting the drug or the placebo, and there is one person on the Loyal staff that knows, and nobody else knows until the end of the study. So it's a mystery, but we've got several dogs on it so far. They seem to be tolerating it well, and we're still enrolling patients.
And so do they tell you what the goal is? Like, what did they define as longevity? Are they trying to extend the dog's life certain years or certain amount of years?
Well, presumably, because it's a double-blinded placebo study, they're going to compare the control dogs to the dogs that received the drug and see if, as a group, they had a statistically longer lifespan than the group that got the placebo.
Okay. Well, interesting. All right. So that's Loyal, FOR Dogs, loyalfordogs.com. We don't get paid anything for this. It's just, I was curious because of the good doctor's experience with it in her clinic. So it's actually the first time I've ever heard of it. But let's go back to your clinic. So your clinic is Whole, WHOLE, healthpetcenter.com. Whole Pet
Right.
Health, wait, wholehealthpetcenter.com. Hey there, this is Rob Ryan. I just want to say how much we enjoy making this content for you here. And if you are enjoying it, would you like our video down below? And would you subscribe to our YouTube channel? It sure does help us get discovered by more people like you who need information like this.
And also down below in our description, the top link is to our trial pack. We hope you'll order one for your dog so your dog can have fermented superfoods that give them nutrition like they can't find anywhere else. Hard to get nutrients that are easily absorbed. Thank you very much. Now back to the show.
Let's talk a little bit about your real passion in your practice, because you obviously can do a lot of things. You have a lot of tools
Right.
in your tool belt, and acupuncture is one of them, right?
Mm-hmm. Yep.
And you went to a nice, really great school for that as well, but you love chiropractic. Tell us why.
Chiropractic, it's actually the last certification that I added. Started with acupuncture, then Chinese food therapy, and then finally chiropractic. It filled some holes in therapy that I was noticing. You know, acupuncture can do a lot of things, but there were some patients where I felt like we were missing something. And so I decided to learn about chiropractic. And to me, it has the greatest potential for an immediate change in the pet. An animal can walk into me in obvious pain, with obvious difficulty moving, and walk out of here feeling great and bouncing and happy. You do an adjustment and the pet looks at you like, oh my gosh, thank you so much. And so my patients love it. I've had pets that had to be drug in here the first time because that's just the way they were about the vet. And then after they got chiropractic, they're pulling their owners in the door. They can't wait to get here the next time. And when you learn about chiropractic, you actually learn functional neurology and why the nervous system is so important. I mean, we kind of all know that the nervous system controls our bodies. What we don't know is that even minor impairments to the nervous system can have profound effects. I think most people think of chiropractic as just relieving an aching back or a sore neck, but we have to remember that when we are relieving joints, especially in the spine, from restrictions in movement, we're also relieving the inflammation around that joint. And that inflammation can cause pressure on the nerves. And whatever those nerves are supposed to do is not happening to its fullest potential if they're impaired in that way. So if that's a nerve that goes to the stomach, maybe a chiropractic subluxation complex adjustment will help them with gastric reflux and they won't have heartburn anymore. Maybe their kidney function will improve if we're using, areas in the middle of the lumbar spine where the nerves go to the kidneys. So it's not just about pain. It's not just about movement. It's about everything. What happens if there's a subluxation complex on the nerve that goes to the adrenal glands, for example, or the thyroid gland or the heart? So definitely there's potential there to have profound physical effects. So it's not just about making them feel better, although that's certainly what my patients notice first.
Right. Will you define subluxation in dogs and cats?
Sure. Yeah. And it's the same in people as well. The correct term that chiropractors use is subluxation complex or chiropractic subluxation complex. Many MDs and veterinarians will argue with chiropractors that, well, you can't have subluxations because that means the joint has come apart. It's damaged. The ligaments and tendons are torn. And that's true of a medical subluxation. So we try to differentiate that a chiropractic subluxation complex just means that the joint is stuck within its normal range of motion. It does not have full range of motion. And when we relieve that stuck place, we give it a little tiny adjustment. It's very fast and it has to be at the correct angle. It has to be on the correct part of the joint. And it's a very quick little twitch and it just frees it up. And then you can feel that movement again. And so the complex part of it is that when it's stuck, you have inflammation, you have restriction of blood circulation, you can have inflammation of lymphatic drainage from the area and edema and swelling, and that puts pressure on nerves in the area. So relieving that little stuck place can fix all of those things in that area.
And will you explain for folks that have never done it and they're probably wondering what that stuck is? Some people just think, maybe it's they always think of bones and all of that stuff. So can you explain what that adjustment actually is resolving?
It's freeing up a stuck joint, but the joint is not like the bones are locked in place or anything like that. Typically it's more soft tissue, but things have just gotten a little bit out of position. Trying to think of the best way to describe it. I guess if you had gears and you know how they intermesh, And if they get a little crooked, they don't turn correctly anymore. So we're making them not crooked anymore. We're just trying to align things correctly so that they can move freely throughout their range of motion again. So it's more of an alignment problem, really.
Yeah. And you have whippets do you still train your whippets?
Absolutely.
Yeah. So agility and all that. So you must do work on them probably daily.
Oh, no. It's veterinarians joke that our own pets are kind of like the shoemaker's children running around barefoot. Yeah. I honestly, I have to admit, I was talking to somebody about this yesterday. One of my whippets often gets subluxations, either his first rib, which is kind of akin to our collarbone, or in his shoulder. And that causes problems with the weave poles. And often I will take him in and we'll go compete, and he'll miss a weave pole or he'll refuse to enter the weave poles. And I go, oh, guess I should have adjusted you before this trial. And I take him out after that run and I go adjust him and fix it so that he'll run it the next time. I try to remember, like before a big event, I will adjust my dogs. I'll do a complete examination, but I don't always remember to do it until I go, there's something not quite right here. And then I fix it. So we're kind of bad about that. My staff's always like, Doc, your dogs were due for their heartworm test a month ago. I'm like, okay, we'll get to it.
Yeah. Something you said earlier about that it's a pretty quick result. You'll see an immediate result.
Yes.
And I've seen this in my dogs, and I've taken my dogs since they were the first day I brought them home as puppies. I've taken them first thing to the chiropractor.
Good for you.
Because a long time ago, it was explained to me when they come out of literally their mom, the womb, they are all contorted. They've been squeezed in with the other puppies, and then they play and they fight and they roll around. So a lot of them need to be free, to be given freedom. So it's the first thing I do. And watching a puppy get chiropractic, it's pretty hysterical. It's very gentle.
Oh, yeah. Yeah. People are surprised. And unfortunately, there's some kind of scary videos floating around of chiropractors who are clearly not trained in working on animals, and they think because they can do people, they can do animals. And those of us certified in animals are horrified when we watch them. They're very violent looking. They're using human techniques on animals that are much smaller. And they're doing it wrong because the animals react kind of violently. They turn and try to bite, or the horse tries to kick, and it shouldn't be painful. There is only about 3 areas on the body where, when we're checking for movement of the joint, the only way we can tell if it needs adjusting is what we call a pain test, meaning we touch it and it hurts. And so there's like 3 places where we do that, and everything else we're feeling for movement. And even those, I did one yesterday. It was a first rib, which is kind of like the collarbone. I have to reach way up in under the neck to get there. And this was a really nice dog. It was very well behaved, and it knew it wasn't supposed to bite the nice doctor. And I touched it, and the dog just sort of froze. I mean, and so I compared sides. So I checked the other side, and the dog's like, oh, hi, how you doing? And I touched the side that I thought maybe needed adjusting, and she just froze. And that was the only response I got. But I went ahead and adjusted it because that was her way of saying, I don't like that. I do tell people, when I'm adjusting that, I'm like, okay, my hand's under the bitey part. So be prepared because this one might hurt, and there's a few places like that, but in general, it should not hurt. And they may show me they're a little tight in that area. The muscles may be kind of tense because they're painful, but the adjustments themselves shouldn't hurt.
Yeah. So the thing you said about immediate benefit, the way I have always seen my personal care of myself and also my dogs is when you go to a team of doctors or a doctor with multiple modalities like you have, and I see things as, tell me if you think this makes sense or is a right way of thinking. I think of it in terms of layering therapies. So, acupuncture, I think of as a little bit more of a longer term play. Chiropractic will give you immediate relief. And then you have herbs that are a little longer, so on and so forth. And right. That's how I visualize. Okay. So you're with me on that?
Yep.
Okay, great.
Yeah. But you kind of need all of them. You mentioned, especially now you're mentioning herbs, and I classify food under that same category.
Yes.
And I know food is important to you as well. Chiropractic cannot have full effects without the body working at its optimal performance, which means you've got to have good nutrition as well.
Yep.
And, and same for acupuncture. If your nervous system isn't working right, then it won't respond to acupuncture the way it should. So you need chiropractic, you need good nutrition. The dog needs exercise, it needs mental stimulation. There's a lot of things that go into health. And you're right about the layering and the immediacy of the different treatments. And nutrition, I think, takes the longest. I feel like, unless there's some really dramatic nutritional deficiency, which I do see a few. There's a lot of people out there with homemade diets that are badly balanced. And some of those, you correct the diet and they respond pretty quickly. But if we're trying to correct a patient's energies or correct some minor imbalances in the patient, I tell people that'll take 2 to 3 months for the nutrition to really do its job, because we have to clean out the bad stuff first while the good stuff comes in and replaces it, and then everything has to heal. And so it can take quite a while, especially if the gut is impaired in some way.
Sure. Well, and also inflammation makes your job as a chiropractor, multiple times harder, because being in an inflamed state, it's just the body's like holding on.
Right. Fights you. Yeah. And sometimes you'll get an adjustment done, and then 2 weeks later they're back and you're doing adjustment in the same place because you've got scar tissue and tight muscles and things that you've got to break down before it will hold. Yeah.
Yeah. Going back to one of the first things you said, you were talking about how some adjustments can relieve certain areas. And we should talk about just listing a few of those things, because I've seen this in my own dog, my second dog, Owen. He was a yellow lab, beautiful, sweet boy. And he got, no matter how much I fed him great, and no matter how much he had in terms of, anti-aging cool stuff going on in his life after he was about 7, he just occasionally had some allergies, and he would get, ear
infections.
Ear infections, thank you.
Right.
But I would do acupuncture and chiro, boom, like literally it was almost a day, because I'd flush his ear, and then it wouldn't come back as aggressive, you could tell. Really interesting. So, yeah. And do you see that in your practice?
I do. One example that I have is, and make sure I mention, how people can tell if their pet needs chiropractic. But I had one patient that had routine gastroesophageal reflux. So GERD, basically he had acid reflux. And we discovered that when I would do chiropractic, I always had to do adjustments in the area where the nerves went to the stomach and the pancreas and the esophagus. And so the owner learned that every time the dog started to do that little swallowing thing while he was laying down, it was time to get him in for chiropractic, because that would fix it every time. So he never had to, he ultimately did end up having acupuncture for a while for other problems, mainly for arthritis and stuff. And we always treated that as well. But the chiropractic really kept that under control for several years. And then when it comes to people, there's people out there, you mentioned the puppies. Absolutely, birth injury is a thing. And plus puppies are really hard on themselves. I just did a puppy yesterday at an agility trial. He's an 8-month-old border collie. Very high energy. He's intended to be an agility dog, and so he's very high drive. And nice dog, and put together well, and seemed to be moving perfectly normally. And I did like 8 adjustments, which is a lot. and she's like, "Oh, I'm so glad I brought him to you." And yes, they can actually have problems that young. And I wish I could get my hands on every puppy in its first few weeks, because you don't want your puppy growing up with impairment of its nervous system. And I adjusted a 6-month-old Australian Shepherd once, and the owner had always had German Shepherds. This was her first Aussie. And she had this 6-month-old dog in for something else, like a Wartella vaccine or something. And she's like, "Oh, is it normal for this breed to not be able to raise their nose above horizontal?" I said, "No." So we adjusted it. I got about 30% more movement. It was the occiput, the base of the skull, that was stuck. And I said, she was probably born with this. This is a birth injury. And so she ended up having to bring her back several times before we got that full range of motion back, because she'd been growing up with this problem and all of the muscles and ligaments had tightened up. And so it took us some time to get it to where it didn't keep coming back.
Yeah. So there's the people who never take their dogs to chiropractic for whatever the reason. They don't believe in it. They don't love it. They are scared of it, whatever. And then there are the people who bring their dogs to the chiropractor once. And then there are people who understand that sometimes you need to come back for multiple visits to follow up. So
Right.
explain why that follow-up is necessary sometimes.
Okay. Well, I would say always. I think all pets need to be adjusted at least twice a year, or at least examined. I say adjusted because only twice and I'm guessing at this point thousands of dogs that I've seen. I mean, I do this at agility trials too, and I've got a stack this tall of single sheet paper just from agility trials, and then all of the patients I see here. But I tell people that their pet should be examined by a chiropractor at least twice a year, or a veterinary chiropractor. And then I base how often they come back on how many adjustments I do. And in all of those thousands of animals that I've examined twice now in going on 12 years, I have not had to do at least one adjustment. That's 2 patients in all of those years. So I've always had to do adjustments. I assume I'm going to do 1 or more, and it's pretty common to do between 2 and 5. So as long as I'm only doing 3 or 4, I'll tell them, probably about 6 months for the next visit. And I think all pets would benefit from twice a year chiropractic checkups. If I do more than that, then I'm going to say maybe 4 months. Certain patients need it more often. I have some dachshunds I see every month because I'm doing 4 or 5 adjustments every single month. Other patients at risk, anything with a long back. So the Shih Tzus, Lhasas, things like that. French bulldogs, their spines are terrible. They probably should be seen at least every 2 months. German shepherds, I say minimum every 3 months. They've got a lot of abnormalities in their spines as well. So it depends on the breed. Pets that are overweight, especially if they're obese, should be seen more often. And they also need to be chatting with their veterinarian about a diet, because that's one of the worst things for a pet's longevity is carrying extra weight. It breaks my heart to see overweight dogs. I mean, I got whippets. So it depends on the pet, and if they've got other issues, maybe they've had knee surgery, so they walk a little differently. Maybe if they're amputees or have a deformed foot, or, anything that moves abnormally is going to need adjustments more often as well, so that we can keep everything functioning as well as possible. And I tell clients there's 2 things that they can do if they're not sure when their pet needs to be seen again. I say minimum this much, but you can bring them back sooner if you notice one of 2 things. And one is when the pet's walking straight away from them, the tail, if they have one, should move equally left to right across the midline, and the legs should move equally forward the same amount. So, and they should be in line with the front feet. So if they notice they're doing what we call cross-tracking, where if they were walking through snow, they'd be leaving 3 sets of prints or 4 sets of prints instead of 2 lines. That's a problem. The other thing to watch for is when they wake up from a nap or they've had a bath and they shake, and they start to shake at the head, and it works its way all the way back until the tail whips if they have one, or the butt gives a good wiggle. And if it doesn't make it all the way back there to that tail, then there's something biting them in between that needs to be adjusted. So that's the biggest one. I just did one recently, and they said, "Oh yeah, I haven't seen my pet really shake for the last couple months." So
that is
they definitely.
A good tip.
Yeah,
it's an amazing tip because typically I rinse my dog Gus off. We go in the dirt, we go everywhere, so he gets a rinsing off. He never gets shampooed. He just gets rinsed off. And so every time he gives a shake, and the minute he doesn't do if I don't hear that shake, I can hear it. I don't hear it. And I look at it too, but I can also hear it. And if I don't hear it, I go, uh-oh. And I immediately like, uh-oh, make a mental note. It's so key. You can start to see if you're looking, you can start to see where they're feeling a little gummy or sticky.
Right. Yeah.
If not stuck.
Yeah. I love my clients, especially the show dog people, because they'll bring their dog to me and it's like, they're short striding in the left front. And I'm like, dang, you're good. I mean, most people aren't savvy enough to recognize that, but boy, the show people, they know when something's off. It's like, they're not moving their right shoulder quite the same. And they usually nail it, and then the agility people, they'll be like, they're having trouble getting into the weave poles, or they seem slow on their right turns or whatever.
Oh, that's so funny.
Certain people tend to be very observant of that. That's
great. And then, so the other thing you mentioned when you were talking about like multiple adjustments when that might be necessary, you didn't mention, but I just want to bring you back to it. Like the very athletic dogs, they immediately qualify for more than every 6 months, right?
Yeah.
Okay.
Yeah,
so
it depends on the job.
That means even if it means zoomies and running, you know.
Sure. Yeah. I tell you, some of the worst necks I find are these Labrador retrievers that people throw the ball for. And the dog goes out there and it dives into the ball and the whole body swings around its head to catch the ball, you know, and those necks are messed up.
Oh, totally.
So yeah, anything
Gus
really
has,
hard on the body like that.
yeah, I mean, Gus has a neck, a constant neck, and back of his around his above his hips that we always got to keep humming.
Yeah.
When I go to the vet, they say, "What's going on with him? Why are you scheduling?" And I say, "It's a tune-up. You know, we just got to keep him tuned up." I would say any athletic dogs and big dogs, you have to use your mind here. You have to think, what's the life? What's the diet, nutrition? What's the age? You have to think about a lot of things. But I would say absolutely. I think you're being more conservative, and I appreciate that. But more than once every 6 months, I would say minimum, if you can do it, every 3 months should be an exam. And boy, I mean, just think about it. When your back is a little out and you know, even if you by accident, you look over your shoulder to back up your car and it cracks and you go, "Oh, that felt so much better." Folks, do this for your dog, please.
Yeah.
Now, on that note, my chiropractor, he says, "Look, I know it feels good, but don't self-crack yourself." So for those thinking about their pets, you know, and they think, well, they're going to self-adjust. They're going to, you know, they wiggle, they do this or that. Tell us why that is a less optimal way of handling it than putting your hands on the specific area. Yeah.
Right. Well, and they actually covered that in my training. And they said, when you're doing that, the joint that's stuck is probably not actually releasing. It's the joints around it that are trying to compensate for that area that doesn't move correctly.
Yep.
And so they said, even if you do manage to do that to yourself, if you immediately went from that and had a chiropractor look at you, they would probably still find adjustments somewhere in that area because it's releasing around it. And I tell people this is really one of the reasons dachshunds have such problems and French bulldogs with blown discs. When a joint gets stuck, sets up that inflammation in the area. Well, the body is always trying to achieve homeostasis, and that means getting back to normal.
Yep.
So our bodies are always trying to heal. They're trying to be as normal as they can. Yep. So when a joint in the middle of the dog's back gets stuck, then the joints around it say, "Hey, we have to take up the slack. You know, we're not getting our full range of motion, what we call global range of motion from head to tail. So this one's stuck. So now we have to loosen up to get that motion back." So the joints around the stuck joint relax their ligaments and tendons, relax the muscles, increase fluid, maybe cause a little bit of edema in that area, and everything relaxes. Well, what happens if you're a dachshund? And right where all of that relaxation is taking place, you have a genetically damaged intervertebral disc. So the way the joints are put together, you have vertebrae. Most of the attachments to those vertebrae, to the muscles and ligaments, are above them. If you've ever looked at a vertebrae, you got the little round body, and then there's all these little bony protuberances, mostly off the top. There's a couple down below as well. But that's where all the muscles and ligaments attach. So this is how I draw it. So here's our little attachments. Here's our body. And then we've got the disc in between. Okay. So you relax all this stuff up here. What does that do? We got a horizontal spine, right, on a dog. We relax up here. That puts more pressure down here. Our spinal cord's sitting right there above the disc. So we squeeze that disc more because we've softened up on top, and it explodes up into the spine. And we can prevent that, at least theoretically, by keeping all of the joints moving with chiropractic. So we can't say, oh, they'll just self-adjust. Yeah, I get a lot of people saying, well, they really hurt, a couple days ago, but they seem to not hurt anymore. And that's because of the body's adjustments that it makes. It's like, wow, there's pain. I have to relax some things. The inflammation is more acute that first 24 hours, and then it kind of turns to a chronic inflammation. It doesn't hurt as much. Yeah. So they still need chiropractic. It just doesn't hurt like I did the first day it got stuck. But I tell people, hey, just, not hurting isn't a good reason to decide not to have chiropractic. It just means the body's adjusted to it a little bit.
Well, also dogs are, specifically dogs, they're pack animals. Their whole millions of years of genetic coding is designed to hide weakness
Yeah.
and they're not designed to show pain. I
No,
mean, they
cats
just
too.
don't.
Cats will hide pain. The only reason your cat hurts may be that they're hiding more or something like that. They're not going to come out and go, ow, my back hurts. But cats love chiropractic, by the way. I tell people
Yes. Yeah.
cats are sybarites. They love pleasure, and chiropractic feels good. And you do a few adjustments on a cat and they're going to be like, I love you forever.
That's great. Yeah, no, I've seen this with lots of vets that I know that do chiropractic, and just the way they're embraced by the animals. The animals like, let's go. I'm
Yeah.
here. I'm ready. Yeah.
I had a Mastiff patient one time, and he came in and he wasn't so sure about me. And I was doing chiropractic, and he had some back pain, and it was tender.
I bet he did.
And I could tell, of course, and he's a male Mastiff, right? So you've got an arm under the belly. You're leaning over the top of their back. This is a big male dog, and they're not going to like that kind of behavior, right? And I could feel him. Of course, I'm all wrapped around him, and I can feel him kind of getting tense, and I feel a little rumble start in his belly. And I found the spot, and I did the adjustment, and then just quickly stepped away to my computer, a couple steps away, while he finished turning around and sort of biting at me, although he wasn't very quick.
Yeah.
And then he stopped, and he sort of moved his head a little bit, and then he walked in a little bit of circle, and then he came over to where I was at the computer and leaned his full body against me like, okay, lady, you do whatever you need to do. And from that time on, he would pull his owner in. She would let him off leash when she walked in the door, and he would walk around the corner and be in the exam room before she ever got there. He couldn't wait to get adjusted after that.
One of my secret career dreams is to do house calls as a chiropractor and do laser and other stuff.
Mm-hmm.
Because these older dogs, it is like such a beautiful gift that is no side effects, just
Right.
relief, quality of life. Oh, it's so nice. Yeah. I used to have a lady that came to my house when I had my two older dogs, and we would just hit it like massive action, the layering of the treatment, the laser, acupuncture, sometimes electroacupuncture, chiropractic, and then I have what is that, PEMF pad? Is that what they call it?
Yeah. Pulse electromagnetic frequency. Yep.
Yeah, they do it on the pad, and sometimes e-stim, all in one session. And they loved when she came to the house. I mean, they just loved her, and they immediately behaved. They went right to the pad, laid down. It's like, go ahead, do it.
Yep. That's actually how I started. I was a regular veterinarian for a few years, and I did relief work for about 10 years, just filling in all over the city, which was invaluable. I learned a lot about how different practices are run.
Yeah.
And I learned what I liked and what I didn't like. And then along the way, I realized there's some patients out there that we don't have answers for. These old dogs that are getting weak in the back end, dogs with conditions that we don't have a treatment for. And that's what led me to learn acupuncture. And after I was certified in acupuncture, I did house call acupuncture for about 10 years. And along the way, there were a few patients that the acupuncture couldn't quite fix. And that's when I learned Chinese veterinary food therapy and using food as medicine and some herbs as well. I'm not certified in Chinese herbs, but food has herbs in it. So I do use them that way. And then I learned chiropractic. And after I had all of those certifications under my belt, I said, I've got enough skills here, but there's still some things I'd like to do. And so that's when I opened Whole Health Pet Center, because then we can provide the whole package, not just the nutrition, the chiropractic, the acupuncture, but we can vaccinate to prevent them from diseases. We do vaccine titers here to measure their antibody levels to distemper, hepatitis, and parvo. So we only vaccinate dogs that need it, not the ones that have good antibodies. And we do a minimal, kind of a tailored vaccination schedule. We look at the patient's lifestyle and we base our vaccines on that. We don't have protocols that we follow. We do use heartworm preventative. We do use flea and tick preventative. The heartworm preventative, I want to point out, there is no proven natural alternative to monthly heartworm preventative.
Yeah.
And I've diagnosed 2 patients here just within the last 6 weeks, and we're going to have to treat them. And the treatment is vastly harder on their body than that monthly pill. So that's, so it's holistic. I think people think of me as an alternative vet, and I don't consider myself alternative. I say I'm holistic. I want my patients to be as healthy as possible So we minimize chemicals, but if they've got a bladder infection, they're going to get antibiotics. They may also get cold laser. They may also get some herbs. They may also get something to support their immune system. We're going to talk about their nutrition to balance their diet better so that they have better resistance, but they're still going to get antibiotics for an infection, So I feel like our approach is what's best for the pet and what will make the pet its healthiest, happiest self. And that's how we do things here.
That's great. I always joke in my head, I don't think I've ever said this, but when somebody says, they're a holistic vet, I always say they're a thinking vet, because they're asking a lot of questions. They're pulling all that information together, and they're saying, well, based on, it's very simple. It's context. It's just based on this life, based on this history of this dog, there's a lot of stuff. And I know that everybody thinks that happens. It doesn't always happen in a lot of vet practices, unfortunately.
Yeah. Yeah. And I tell people I've just got more tools in my toolbox. You mentioned cold laser. We love cold laser. We use it here all the time. We use it on the staff. That cat scratched you, go cold laser that, pulsed electromagnetic frequency. I prescribe a CC loops regularly. Multimodal, especially for pain relief. I don't want to see my patients painful. And do we use pain medications? Absolutely.
Sure.
But I also use acupuncture. I could use cold laser, pulsed electromagnetic frequency, chiropractic. There's a physical therapist I'll refer to. I may teach the client some massage or physical therapy techniques to do at home. There's so many things that you can do. And until you've tried all of them, you don't know how much pain you can relieve. So, I get frustrated when people say, oh, I don't want to use any medication. I'm like, your dog's standing here whimpering, it hurts. Let's not allow that to continue, and maybe we'll use pain medication now in hopes that later the acupuncture will relieve enough the pain that you don't need it. But let's make your pet comfortable first and foremost, and then go from there.
Yeah, I'm so in favor of that. I'm like, bring the drugs when you need it. The question is, do you have a pro that you're working with that can tell you exactly when this is the time? It's not, as opposed to just, let's give them pain meds. We don't know. Let's give them pain meds. When you absolutely need it, boy, steroids, antibiotics, all those things are amazing. And, unfortunately, sometimes you need to bring out a hammer to pound a nail.
Yeah.
Just the way it is.
Sometimes you need a whole toolbox.
Sometimes you need a whole toolbox.
Yeah.
I'm right with you. I am fortunate to avoid most pharmaceuticals because I take a quick enough action, and I know enough of I have great people that I go to, so we can avoid. We address the infection before you need antibiotics. I'm in their preventative care with chiropractic. This is what it's about. It's about being proactive.
Right.
But guess what? If you're not, if you're in the doghouse, I call it, the penalty box. If your dog is not, or cat or bird or anything is in that space, you got to do what you got to do.
Right. Yeah. Yes. Pet health and pet comfort first. And, it's medicine's not a religion, We get too many people who say, oh no, I'm opposed to that. And I'm like, well, do you want your pet better or not? Sometimes it's nice to have principles, but let's keep our pet's comfort first and foremost. Let's not let the pet suffer because of principles, right? Let's give the pet what it needs. And then, we can look at alternatives, but let's be proactive about keeping that pet happy first. And, and then there's nutrition, which I'm of the belief that if we can find the right diet for a pet and have it on a healthy diet from the very beginning, we're going to see a lot less of these problems.
Yeah.
Healthy weight, man, there's, most veterinarians will tell you, 2/3 of my patients are overweight, and I think less of mine are because I harp on it every time. If my patients gained a pound, I'm going to tell them, hey, your pet's, 3 pounds above where I would consider its optimal weight. Let's work on that, right? At every single visit, because they've shown in research that pets maintained at a 4 out of 9 on their body condition score, or even slightly under that, live up to 2 years longer. And who doesn't want their pet to live 2 years longer? And then you get these pets that are so overweight, they can't hardly get themselves up. And it just breaks my heart to see it. And I will tell clients every single time, your pet's still overweight, your pet's still overweight.
Yeah.
And some veterinarians don't want to address it to that degree, but that's huge. And then what are the nutrients in the diet? Are you providing the food that has all the nutrients they need in an easily accessible and easily digestible form? Yep. And kibble isn't going to get you there. If a 100% kibble diet is not going to yield a healthy pet.
Yeah.
Just won't. I don't care what kibble it is.
Yeah. But you said easily digestible and bioavailable. There's a key right there.
Absolutely. Yeah. Yes. And kibble ingredients typically are not bioavailable. They're very bound up. They've been damaged through the heat processing. And I feed some kibble to my dogs. I have a busy schedule. I'm at work full time. We do agility on the weekends. Kibble's easy, when I'm tired in the evening, but I also feed some raw and some cooked and some raw or dry canned food and freeze dried stuff and all kinds of things. So my pets get a constant variety in case one food doesn't provide them with all the nutrients that they need. And it also helps keep a healthier gut because of the variety that they get. And I do try to stay away from very much kibble because it is inflammatory. And that's where so many of these dogs get skin problems. You mentioned your dog with the ear problems. And the first thing I would ask was how much chicken was in his diet.
That's funny. Funny you say that. He always would get organic chicken and all that. But he was a dog that I actually went pretty low on the chicken. I did turkey. But I started to figure that out with him.
Right. And a lot of people get the idea their pets are allergic to chicken because they see that. They feed a chicken-based diet. The dog gets skin problems, ear infections. It's usually not an allergy. I've really only seen a few pets over my 30 years where I was absolutely certain they had an actual food allergy. Yes. But chicken in Chinese medicine, chicken in Chinese medicine is a very hot protein. It adds heat to the body. And depending on the patient's, what we call their constitution, their makeup, there's a 5 elements thing in Chinese medicine. So if they're prone to heat damage because of their own constitution, then that heat goes into the body and then it has to come out somewhere. And it's going to express itself as redness, irritation, itching, infections, things like that. So that's chicken and lamb is the same way.
Yeah. And I have my dog, my 2 other dogs, my 2 other black labs. Buddy's no longer with me, but he was black lab, and my dog now, Gus. Chicken, no problem, 0 problem. Same chicken maker, same chicken, farm, everything. Right. And it's totally that. It's the TCVM. Yeah.
And some pets need things like chicken. You get these old pets that are all shivery and they're always cold and wanting to crawl under the covers. Feed them chicken and lamb by all means. Warm those poor things up.
But
if they're prone to skin problems, got to stay away from those.
Yeah, warm vegetables and warm spices, all those things are at your disposal in TCVM. Yeah. How many dogs do you have?
3.
3? Okay.
All related.
We'll have to send you a bunch of bags of Gus's gut. I want to hear what you think.
Oh, cool. I got 2 half brothers. 14-year-old just retired from AKC Agility 2 weekends ago. And his younger brother, 12. He'll be 12 in July, and he's still competing a little bit, about 2-3 runs a weekend. And then their nephew, Brand, is my hot shot, and he's just turned 4. And he went to AKC Invitationals in Florida last December as one of the top 5 whippets in the country. So he's going to be a lot of fun through his career.
Well, I want to go back to something you said about the dogs that are like they're athletic, they're at the agility. Like later in life, what do you think? Well, even not agility, just like my dog's super crazy athletic. He jumps off the ground, he lands on his back, back legs and all of that stuff. That jars the neck, everything, right? Sure. But that's what he loves. Like I'm not giving that to him.
Right.
So as they start getting older, what are some of the things we can do to, ensure that quality of life and ease of movement and, the joie de vivre, the zest of life. Yeah.
Right. So first and foremost, good nutrition. Yeah. Easily digestible diet. I find a lot of extremely old pets start to lose weight, even though they're on the same diet they've always been on. I think their gut gets a little less efficient, less good at absorbing nutrients. And so if they are on a more processed diet, like a kibble diet, that's when I say, hey, we got to get them off kibble. It needs to be more digestible. It may just be a switch to canned, probably better, a cooked type of food. Just Food for Dogs is one I recommend a lot. Chi Dog, if you like the 5 elements stuff, things along that nature. I think Ollie and Farmer's Dog have some cooked formulas as well. So things like that are easier to digest because they're less processed. So that's one thing, is to make sure they're on a balanced diet that's easy to digest. Joint supplements, absolutely. I think my dogs, I put on a joint supplement at 8 weeks because I know they're going to be really athletic. And I think all dogs can benefit from joint supplements. If not from puppyhood, then I would still at least start them when they're probably 5, 6, 7 years of age, and put them on at least a maintenance level. And then if they have arthritis, then they need to be on a higher level. And I find that a lot of the common joint supplements, Cosequin, Dasequin, tend to underdose somewhat the glucosamine on dogs that really need it. Lately, I've been using Regensa quite a lot. I really like it. I've had clients who have been on other joint supplements. We give them a free sample of Regensa and they come back for more because they see a difference, even though they were already on a joint supplement. So those things, and then proper weight, absolutely got to maintain a healthy weight. And if they're overweight, you've got to get that extra weight off. And you don't want to get too extreme with a really old dog because they do often start to lose weight when they get really senior, mid-teens. But still, don't let them be overweight because that's hard on the joints. And then routine exercise. I tell people, they're like, well, how far can I walk my old dog? I say, well, how far can they walk without hurting more the next day? And if they say, oh, well, they go half a mile, I say, then half a mile is how long they walk. If they can go 2 miles, great. But they absolutely have to get up and around. I think that's one of the biggest mistakes people make with their old dogs is they say, oh, well, they're so old, we won't make them go exercise. And then they lose their muscle tone. They lose the lubrication of the joints, and they go downhill fast. Plus, there's that quality of life issue. They feel left out, if they have to, maybe they've got a younger dog and they're like, well, the old dog can't keep up with the young dog on the walks. So I say, get a wagon. If they're a small enough dog to put in one of those collapsible wagons, throw a dog bed in there, go for a walk. When the old dog gets tired, put him in the wagon, let him have a ride for a while.
Amen.
And I've had clients put them in one of those strollers and take them to the park, let them amble around the park a little, put them back in the stroller and take them home. They can still have that quality of life. They just maybe have to cut back a little bit.
Yeah, it's so true. I mean, we domesticated these animals. They want to be with us. Mm-hmm. So I think you're so right about just bringing them along and yeah, don't you just feel horrible? Probably right after you feel sorry for the dogs that are overweight, but for the dogs that they slowly die of boredom. I believe that's
it's shuffled out of life,
Yeah, just boredom. So lack of purpose. I totally believe that's a thing, and I think it destroys their microbiome also, by the way, because it's stressful.
Sure. Yeah, any stress can damage the gut.
Yeah. Well, this has been so fascinating. I could be at a 3-hour dinner with you anytime and talk to you about all kinds of stuff with chiropractic. I love all the stuff. So I think what we'll do is we'll end on this topic, but I'd love to come back to you. And I'll also like to hear about this longevity study. One last thing on longevity, because I know you're obviously interested in it. Mm-hmm. What do you think about in terms of we're looking for drugs right now. We're looking for pharmaceuticals or I know there are people looking for it. I'm not, right. But more. But wouldn't you say that probably one of the most powerful longevity drugs is hormones?
If they're in proper balance, yeah. I mean, I don't know about longevity drugs, but I mean, in terms of taking extraneous ones, maybe not.
No, but
keeping your own in balance. Yes. You've got to keep your own in balance. Absolutely. I don't know that I would say, oh yeah, take extra thyroid hormone to live longer or something like that, or like ghrelin, the appetite's depressant, things like that. I don't know. I guess I'm just more in favor of let's make the body work to its optimum capability. Because, our body wants to live as long as possible. It wants to be healthy. It wants to be in homeostasis. And we just need to get out of the way and provide it with what it needs and not damage that with a bunch of, artificial colors and preservatives and unhealthy food and things like that.
Sugar. Yeah.
Sugar, yeah, yeah, or artificial sugar, your Diet Coke, whatever,
Well, where I was going at with the hormones was I was absolutely not talking about the exogenous hormones, but the ones that we get, we all get when we're born with them, and
Hmm.
then we end up fixing our neutering or spaying our dogs,
Yeah.
and so you lose the benefits of all that. And my dog Gus is now 7, and I'm now seeing just the incredible benefits of his flexibility of his arms and his all of his joints. And
Yeah.
my other 2 labs did not have that. And
Yeah.
just the amount of weight, like he is at a perfect weight, and he does not get that fat lab syndrome that every single lab seems to get.
Hmm.
It's just, I mean, I know I feed him well, but it's just amazing. And so I just think I think we might need to revisit this idea. I know why some people neuter and spay. I understand that. But I also think we need to maybe re-examine it. In a one size fits all treatment, as we're talking about longevity, that's the top of my mind is our
Yeah.
own hormones. And we just cut them off at the
Yeah,
age
I
of
think that's
7.
part of it. And I'm different than a lot of vets. I'm not, oh, your pet's 6 months old, let's go have surgery. And I don't do surgery here. We send them out. But I'm not in favor of people irresponsibly letting pets breed, which is the main drive for everybody doing 6 month spay neuter, right?
Sure.
But I have a 12-year-old and a 4-year-old intact male dog who have never created puppies that weren't wanted, right? They don't roam loose. They're not going to be out there reproducing until I decide if or when. Female dogs are a little harder. Not everybody is set up to deal with a female in heat.
Yep.
And then there's the whole, I tell people, it's like, I think it would be great if your, young Labrador retriever went through a heat cycle or 2 before she's fixed, right? Let's spay her, but not until she's had at least a heat cycle and has reached her full mature growth, right? But she's going to have to wear panties when she's in heat, and it's going to last 3 weeks, and you may have some cleanup to do, and you have to go outside with her every single time and be supervising her when she's outside, because every male dog in 2 miles is going to be knocking on your door. Some people don't want to deal with that, right? And I get that. So I'm very upfront. And then there's the risk of a pyometra, an infected uterus, in any dog that goes through heat cycles. So I say, if you're going to do this, make sure you understand those symptoms, that you're watching for that, so she can be spayed if it happens, but you got to catch it early, right?
Right.
Males are a little easier, but you can't, it's not all cut and dried that, well, if you leave them intact, they're going to be healthier. What happens if your male dog gets prostate cancer or testicular cancer, right? I mean, those things can happen to males. So it's not, leaving them intact fixes all the problems, right? It's not necessarily the same. And then, of course, the females can get uterine cancer and ovarian cancer if they're left intact. But, I'm in the show world. I do agility with my dogs. I know a lot of show people, and they've all got intact animals. And these things are not 100%. Not every intact female is going to get mammary cancer, uterine cancer, ovarian cancer, pyometra, unwanted litters, right? It's not a given any more than it is in people, right?
No.
So, but those are mostly things that if you catch them in time, they're treatable.
Yeah.
Same for the male dogs. If male gets an enlarged prostate, neuter him then.
Yeah.
Problem solved, right?
Yep.
Testicular cancer, neuter him. Problem solved. Those don't spread very easily. Yep. So if you catch them soon enough, if they're getting regular checkups, and that's one thing that, if you've got an intact male, make sure your vet sticks a finger up the rear end and feels that prostate every year. Just keep an eye out, I'm a veterinarian. My poor boys are like, why are you feeling me there? You're counting those every few months. It's like, no, I'm checking to make sure my 12-year-old has equal size jewels there. We don't want him getting a tumor that I don't catch. Right. So, right. Yeah. So it's a matter of preventative care and monitoring, but yeah, there's a study, and I don't know if I'm sure you're probably familiar with it. I think it was Auburn that did the study in certain kinds of cancers and joint problems in about, I think it's 33 different breeds. And retrospective study, they studied records from thousands and thousands of dogs, looked at what age were they spayed or neutered, were the male or female spayed or neutered, and at what age, and what of these health problems, there were 6 or 7 health problems they looked at, and which problems did they develop or not develop. And then they made a chart, and I have that chart in my exam room. And every time somebody brings me a puppy that's on that list, we look at it.
Wow.
You know, for example, I believe it's, I think it's German Shepherds, either German Shepherds or Golden Retrievers. Females, they say you shouldn't fix them. There's too many health problems that arise from, you know, there's 2 or 3 breeds where it's like, don't do it. Don't spay this breed. Don't neuter this breed because you see more health problems. And others, they're like, yeah, doesn't matter. Any age doesn't, you know, it's fine. And it says, you know, 6 months, a year, 18 months, or not at all, I think are your choices, you know, for spaying and neutering males and females of these 33 breeds. So I wish they were all on there. They're not. But every now and then I'll look up a breed and I'll go, oh, well, it says here you shouldn't neuter this dog, you know, because you're more likely to see health problems than if you don't, you know. So
amazing. Wow. Oh, I would love to see that. I don't know about that study. I would love to see that poster. Maybe you can shoot a picture of it and send it to me.
Yeah, I can probably do that.
I would just love to see it for myself. Yeah. I'll look it up and see if I can buy the poster or something.
Yeah. Well, it's just a chart. It's actually just a chart from the
study.
From the study itself.
Oh, it's a small chart. Okay.
Yeah. It was just in the actual study.
Yeah. Okay. Well, great. Well, listen, Dr. Leonard, I really appreciate your time today and being with us, and I hope we can do this again and continue where we are leaving off.
It's been very interesting.
Thank you. And this is your first podcast, right?
Very first. I'm old and technology averse.
Good. Was it fairly painless?
It was. Yeah, you made it easy. Thank you.
All right, good. Well, it's been great to be with you. Thank you all for joining us, everybody. Have a great day. Take care.
Thank you.